Hi, I'm Dr. Sandeep Nayak, Director of Surgical Oncology at Fortis Hospital, Bangalore and Max Clinic, Jayanagar, Bangalore. I am aware that a cancer or a diagnosis of cancer is a panic situation in the family very often. It is a concern for the cared ones, but remember, it is not an emergency in most of the situations. A treatment of cancer is a very planned thing. It is not to be done in haste. So whenever it is done in haste, you tend to miss a lot of things. So generally when we classify cancer surgeries into emergency surgeries, which are required for very small number of cases, like where there is a massive bleeding or when there is an obstruction of the intestine. These are emergencies which require a very urgent surgery or emergency surgery. Apart from this, who require an urgent surgery are those tumors which are more aggressive, that they are growing fast, we need to do it quicker, or they are going to obstruct or going to get into complications, we need to operate. Barring these, they are not an emergency. Many of them can wait for 2 to 3 weeks and the case can be done in a much planned fashion rather than in an emergent fashion. So in the season of this coronavirus outbreak, many patients have asked me this question, whether we need to go for surgery urgently or we could wait. And most often the answer is you can wait. But it has to be case to case basis. It has to be decided on case to case basis, and there is no one sentence for all of this. So every time, be it a consultation or be it surgery, we decide based on what we see. The merits of the case is what will guide us in deciding whether we need to operate immediately or we can wait. So we do not recommend an urgent surgery in most of the cases. There are many times when a patient can be put on some simple medications and made to wait. In this situation where there is a risk of super added infection which can complicate matters and send things into spiral. So we can put the patients on simple medications which can be taken at home, and the disease can be kept under very good control to be operated or to be taken up for surgery at a later date. It is possible. So we will guide you as to what should be done when you consult us, either over the video consultation or in person whenever we call you. So let us understand why we are doing this. Cancer patients are always at a higher risk of infection and the complications related to infection. So same thing applies to the coronavirus infection as well. Now when a surgery is done, the patient's immunity also drops with surgery. Plus the patient is in an environment called hospital, where there are plenty of infected patients. There could be more cases with corona detected or undetected. The relatives of or caregivers of the patient are traveling in public transport, are mingling with other people. They also can get infected. So your hurry to take or go for surgery lead you to getting into some kind of problem associated with other infections, and you may end up in a worse situation than what you started off with. For that reason, if it is possible to avoid a surgery at this time, we would strongly recommend that you avoid it. But it is subject to your doctor telling you that it is avoidable. Many organizations in the world have done this and have released advisories in the interest of the safety of patients. These advisories in most of the situations have divided the type of cancer and the situation into many levels and have advised the treatment or the management to be decided based on these levels. So that's what we are also doing. It is not for you to decide whether it's an emergency or not. It is for your doctor to decide whether you require an emergency surgery, urgent surgery, or how to make this entire process possible for you. So allow your doctor to think for you and decide what should be done. We are continuing to work for you. We are there for you when you need us. So we request you to listen to us and take care of yourself. Thank you.